There's something most people don't want to talk about, but we must. Sometimes, the body starts to whisper before it screams. Hi, I'm Dr. Luke Smith, and after 3 decades of working with aging adults, I can tell you. Many people show subtle signs that the body is slowing down, almost like nature is gently preparing us for a transition. But here's the good news. When we notice these signs early, we can often take steps to slow the decline, improve quality of life, and help our loved ones feel truly supported. So in today's video, we're diving into 5 signs elderly people may show a year before death. These signs are often overlooked, but once you know them, you'll never ignore them again. If you care about your health or someone you love, I encourage you to watch this video all the way through. Please like this video, subscribe to the channel, and comment below if you've ever noticed any of these signs in yourself or someone close to you. It might just save a life. Let's begin with the first major sign: unexplained weight loss. Now, I'm not talking about a few pounds here and there due to diet changes or exercise. I'm talking about a steady, noticeable drop in weight without trying, especially in someone over 60. Here's what I've seen countless times in clinic. A patient comes in, they say, "I haven't changed anything, doc, but my clothes feel loose and my belt is tighter." They might even look pleased at first. But this kind of weight loss, especially muscle mass loss, can be a quiet alarm bell. Why? Because it could point to several hidden problems. Poor nutrient absorption, which can mean the gut isn't functioning properly. Metabolic decline, where the body starts using energy from muscle rather than food. Or it could be the body entering what we call a catabolic state, where it breaks down faster than it rebuilds. And here's the important part. This often starts a year or more before any serious event happens. But it's not too late to act. If you or someone you love is losing weight unexpectedly, please don't brush it off as a good thing. See a doctor, ask for a full blood panel, check muscle strength, ask about digestive health. Sometimes, a simple protein-rich diet, more hydration, and physical therapy can stabilize this process. The body wants to fight, but it needs support. In part 3, I'll share a less obvious but equally important sign, one that shows up in how someone speaks. Stay with me. Now, this next sign is one many families overlook until it's too late. It's not physical, it's behavioral. I'm talking about sudden changes in speech, mood, or personality in an elderly loved one. Let me give you a real-life example. A patient named George, 74 years old, was always cheerful and quick-witted. His daughter brought him in one day and said, "Dad's been quiet lately. He forgets words, repeats things, and just seems off." George didn't have a fever. He wasn't in pain. But I immediately knew something was happening in the background. Here's the truth. When the brain isn't getting enough blood flow, or if small strokes are occurring without noticeable physical symptoms, it often shows up first in how someone speaks or behaves. Watch out for signs like slurred or slower speech, forgetting simple words mid-sentence, confusion about common things, sudden mood swings, apathy or loss of interest in things they once loved. These aren't just aging. These can be red flags for early-stage vascular decline, silent strokes, or even pre-dementia conditions. And sadly, many of these symptoms appear up to a year or more before a major health event like a stroke or severe cognitive drop. But there's good news. With early action, brain scans, circulation tests, and even simple changes like better hydration, B vitamins, and light exercise, we can often slow or even reverse the decline. So if someone you care about is not themselves lately, don't wait. Talk to a doctor. Ask the hard questions. Because silence, literal or emotional, can be a warning whisper from the body. In the next part, we'll talk about a more subtle but extremely telling clue, a change in how they move. I'll see you there. When someone begins to emotionally and socially retreat from the world, it's more than just getting older. It may be the body and mind's way of preparing for a final transition. You'll notice it in subtle ways at first. A once talkative mother stops calling. A neighbor who used to greet you now avoids eye contact. Or a grandfather, who was always the life of the party, now stays in his room, quietly looking out the window. This withdrawal can happen slowly, almost invisibly, until one day you realize how distant they've become. This isn't just sadness or depression. In some cases, it's the body conserving energy for what's ahead. The world becomes quieter, smaller. Their interests fade, their conversations shrink, and their eyes seem to look somewhere beyond the moment. This kind of disengagement is heartbreaking to witness. But here's what I want every listener to know. Sometimes, that withdrawal is reversible. Yes, especially if it's linked to undiagnosed anemia, hormonal decline, heart failure, or even something as simple as dehydration. That's why it's vital to act early. If someone you love is withdrawn, encourage light daily routines. Get them outside, even just on a porch. Share music or spiritual reflections. And always, always check in with a physician. Because if the body is giving up before its time, there's often still a chance to turn things around if you catch it early. We're not helpless in this. You're not helpless. Let's continue to part 5, where I'll reveal one of the most overlooked signs, the body's temperature, and what it means about how close someone may be to the end. There's one sign, quiet, often missed, that can reveal the body is losing its life force. Coldness. Not just a passing chill, but a persistent, unnatural coolness in the hands, feet, or even the nose and ears. I've had family members tell me, "Doctor, her hands have been freezing for weeks, even in summer." Or, "His feet are cold to the touch, and he's wearing 2 pairs of socks." Let me explain what's happening. As circulation weakens and the heart begins to slow, blood is redirected to protect the brain and vital organs. This means the extremities, like fingers, toes, and even the tip of the nose, receive less blood flow. Less blood means less warmth. But here's where it gets serious. This coldness, if it's consistent and worsening, may indicate the body is conserving energy for its final chapter. Sometimes it's part of what we call active dying, a phase that can begin many months before death. But it's not always the end. There are cases where circulation can be improved. We've had patients come back from the edge by making small but vital changes. Nutritional support with circulation-boosting foods, gentle massage or warm baths to encourage blood flow, keeping the room temperature stable and cozy, and reviewing medications that might be slowing heart rate too much. If you touch someone you love and they feel unusually cold, don't just grab a blanket. Ask why. Check their heart rate. Look at their skin color. Early detection can change everything. These signs aren't just warnings. They're whispers from the body, asking us to listen, to act, to care. Because even when death feels near, dignity, love, and action still matter. If this video helped you understand something deeper about your loved ones, or even yourself, I invite you to like this video, subscribe for more life-saving insights, and share this with someone who needs to hear it. You are not alone. I'm Dr. Luke Smith, and I'm here to walk this journey with you.